Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens.
Join me, Dr. Taryn, and health expert Emma as we explore delicate subjects related to the women's health space.
We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it.
The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends,
Let's begin.
Hey, Ta.
How's it, follicle friend? How are you?
I am slightly under the weather today, but, dedication to the Ovarian Club. I'm here with you today because I know this is a topic you have been dying to talk about, so could not let you down.
Thank you. Thanks for pulling through on a Saturday night to talk all things thrush and bacterial vaginosis. Literally, the topic I have been waiting for since we launched the podcast back in January 2025. It's just like at the end of the day, both of these conditions, both yeast infections and bacterial vaginosis, are so common in women of reproductive age. And they ask me these questions all the time, like, why am I getting this? How do I prevent this? Doctor, give me the answers. And it's obviously led me down rabbit holes and prompted me to research these topics extensively. I'm just beyond excited to share with you all my research and what I know about BV and Candida as a doctor.
Literally, and has been like, this is the topic I want to do. This is how I want, please, can we do it? I have a title in mind. I have everything. Please, please, please. So
what
the motivation is, what the thrush? The motivation is definitely there. So let's dig in. Just a couple of disclaimers. The views expressed on this podcast do not represent any of the views of the company I work for.
And yes, just a disclaimer my side, although I am a qualified medical doctor, this podcast does not serve to offer any personal medical advice. So always seek the advice of a healthcare professional with regard to any condition or treatment you may be seeking.
So let's dig in. What is a yeast infection, thrush, candida versus bacterial vaginosis?
Two very different conditions with slightly overlapping symptoms, but also different symptoms. So let's tackle yeast infections first. And as you correctly said, yeast infections can be referred to as Candida, Candidiosis, thrush, as it's colloquially called. And basically, this is due to an overgrowth of yeast in our vaginas. Now, yeast naturally thrives in our vaginas. Actually, it thrives all over our bodies. But when an overgrowth occurs due to factors that we're going to address soon, this overgrowth of yeast can lead to a range of very undesirable symptoms. So in the case of yeast infections, the most common symptom is that white cottage cheese discharge. And I say cottage cheese because it really does have that consistency and it's non-odorous. It doesn't smell. So if you have like a white discharge, not smelly, it's not in keeping with your ovulatory cycle, like it's a totally different discharge to what you know. And it's itchy and it's irritating. And sometimes there's some redness and like that chafing feeling. You just feel uncomfortable there. You likely have a yeast infection. Of course, always consult a healthcare professional. But yes, that is essentially yeast. BV, bacterial vaginosis, we can abbreviate it to BV. This is another very common condition in women of reproductive age, which is due to an overgrowth of anaerobic bacteria, bad bacteria that we don't want in our vaginas due to imbalances in our vaginal microbiome of the good bacteria versus the bad. And when the bad bacteria thrives, it produces symptoms of bacterial vaginosis, which basically it raises the pH, which makes the environment more alkaline. Okay. And when this is the case, the anaerobic bacteria thrive and they release enzymes that break down proteins that release amines, which gives a very fishy odor. Okay, so the discharge might be thin, gray, and typically very fishy smelling. Yeah, that is how it smells. So it's quite diagnostic if it has that like whiff. Of course, doctors, we've got a criteria called an Amsel criteria that we use to distinguish BV from other infections. And that's how like the presentations slightly differ.
But I imagine, and I have read that they tend to be kind of confused often, or the reason why we're tackling both today is because they can be confused for one another, but they're very separate. That's correct, right?
That is correct. But interestingly, BV can also predispose to thrush. There are intrinsic links between BV and thrush. And like the one can precipitate the other. It is quite possible to have both. For example, if you treat BV with an antibiotic, metronidazole, which we commonly use in our setting, if you treat a patient with metronidazole, give the patient antibiotics to treat the BV, you can then cause a thrush because antibiotic use is one of the major risk factors for developing Candida yeast infections.
Well, that's actually my next question, but just kind of to summarize a little bit, yeast infections, thrush, caused by kind of imbalance within the vaginal flora, I want to say. And that presents as kind of a cottage cheese-like discharge, itching, redness, chafing, etc. Whereas bacterial vaginosis is due to a bacterial infection or kind of bad bacteria disrupting also the pH levels, if I'm not mistaken. And that it presents as a very different kind of discharge, kind of gray and watery, if I recall correctly, and also fishy smelling. So that smell, the thrush does not smell, bacterial vaginosis does.
Yes, no,
if I summarize that correctly.
You summarized that perfectly. Yeah.
And why does it happen? So why do we get a yeast? And let's keep it kind of distinct. Why you mentioned antibiotics for yeast infections as one of the causes. What causes it?
Okay. If a patient has, for example, poorly controlled diabetes, this is a huge risk factor for the development of thrush. It's not to say that all patients with diabetes get it, and patients without diabetes also get it, but diabetes is one of the main risk factors, and that's because of the glucose dysregulation in the vaginal microbiome. So what happens is if a patient has poorly controlled sugar levels, the sugar basically is dysregulated in the vaginal microbiome, and the Candida, the yeast, thrive off glucose. So that is a very big reason why sugar regulation in the case of diabetes can predispose to thrush. Another main risk factor, besides for antibiotic use, which is probably the most common, is just being in an immunosuppressed state, right? So if you're sick, you're unwell, your immune system shuts down. The immune system usually keeps things in check down there. And if the immune system's dysregulated, thrush commonly thrives. I know it's happened to me. And then another important risk factor is if you have urinary incontinence, that could create a moisture-rich environment in the vaginal microbiome and enable the proliferation of Candida and cause symptoms.
And it's also hormonal, right? I mean, it's also linked to,
Yeah.
so I mean, TMI, but when I was 12 or 13, I used to get recurrent yeast infections, which is kind of crazy because I think it's also, and then we'll touch on that, the fact that it's nothing linked to sexual activity or anything of the sort. That's true. I'm not diabetic. I had an exceptionally healthy diet. I wasn't a big sugar rush kid and stuff like that. Immune system, but have also read it could have been due to hormonal changes, but also it's also to do with staying in wet costumes, right? If you're wearing your swimming costume and you're keeping it on the whole day, which kids obviously do, or if you are wearing very synthetic materials as underwear or very tight clothing and stuff. Never got it again, kind of disappeared, was all good and chilled, but I thought it was an interesting thing, and I did kind of look into that. Why was that the case? So hormones and also your clothing makes a big difference, right?
100%. So the moisture-rich environment that I was alluding to, yes, I'd say damp clothing could likely be a predisposing factor for that reason. But I'm so glad you mentioned hormones. Of course, hormones play a huge role. And it's not just any hormone, guys. It's estrogen. So studies do show that high-dose estrogen pills can predispose to thrush. The reason being is that estrogen in the pill can basically trigger glycogen to break down to glucose in the vaginal epithelial cells. And as we said, the yeast love the glucose, and that's why it proliferates and thrives. Now, that's not to
don't say that in basic English.
Oh, okay. Very simply put, long-term, your use of high-dose estradiol can promote candida overgrowth by increasing glucose in the area. Okay, and then we know that the candida loves the glucose, it munches on that, and that's how it grows. Now, that's not to say that everyone on the pill will develop thrush. So please, that's not what I'm saying. But it's not uncommon for girls on the pill to develop thrush for this reason. But also, this high estrogen state need not only be when taking the pill, right? It can also be, for example, as you fluctuate with your hormones, right, throughout the cycle, or estrogen surges, as we know, post-puberty, there's a huge surge. So it's definitely more common in girls of reproductive age. That's typically where we see it the most. Post-menopause, when the estrogen levels dip, that's where we see decreased incidences of thrush. So that's one nice thing to look forward to.
Taking an estrogen, hormone replacement therapy, right?
Sure, of course. Which may or may not contribute to it further, but yes, that is something valid. Although the hormone therapy that we typically prescribe these days is the transdermal one. Yes, vaginal estrogen can also be prescribed, but generally that's because everything atrophies, dries down there, and women sometimes really feel like they need estrogen to buffer the linings. So it serves a different purpose, right? Like, you could almost argue, if you're not using the estrogen down there, things are dry, and when things are dry, organisms thrive, So it's a bit of a catch-22. It's not so straightforward.
And I wasn't on the pill at that time at 12, 13, but it is interesting to understand it. And I think that's a really important misconception too. We kind of just assume, and I know that's slightly different, and we'll come on to bacterial vaginosis now, but we kind of just assume that it's something like sexually transmitted or sexually related, and thrush is by no means necessarily at all sexually transmitted. But bacterial vaginosis is a different story, right? So why does BV happen?
Okay.
Why do people
I love that you've done your research, by the way. I'm so impressed by you. In these questions, girl. Mrs. I haven't researched anything. Please, you know so much. I'm so impressed.
ChatGPT. I'm sorry, my other best friend.
Okay. So, BV is, basically, as we said, it's due to the overgrowth of the anaerobic bad bacteria versus the good lactobacilli. And there's so many different risk factors. But basically, the main culprits in the case of BV would be anything that also disrupts the vaginal microbiome. And what we see very commonly, actually, in our setting, are women who douche, right? Do you know what the word means? Douching. Douching is when you
and it's also from using, and apparently that's also with thrush, right? Something that we didn't actually mention, using kind of feminine hygiene kind of washes and stuff like that, or very perfumed stuff, or lying in the bathtub with bubble bath, which totally absolutely used to do as a teenager. All of those kind of things disrupt and can cause thrush too, right? But also bacterial vaginosis.
Absolutely. Then that's what the two share in common, right? Anything that's going to disrupt the vaginal microbiome can either lead to a candida overgrowth or the development of BV. You remember, our vaginas are self-lubricating organs. They don't need anything up there, okay? It sorts itself out. The moment you disrupt the microbiome and attempt putting foreign things up there, fragrances, soaps, things that should not belong there.
Lube, which you discussed in the previous episode.
Look, even lube I wouldn't recommend unless it's absolutely necessary. It must serve a purpose. Otherwise, the best lubrication is nothing. Of course, if you need something, then you should look for a lube that it best fits the vagina. And we spoke about that in one of our previous episodes.
And everything.
The pH, you must really take a close look. But that would be an example if you put a bad lube up there. It's going to be very harmful. Other risk factors for BV is actually cigarette smoking. So smokers have significantly lower levels of the protective lactobacillus bacteria, which is essential for maintaining the pH of the vagina and inhibiting that anaerobic growth. So smokers, beware, you are at risk of BV. And then, sex. Let's chat about it.
I don't know why, but I want to start breaking into that song. Let's talk about sex.
Saturday night. No, so basically, both BV and Candida are not considered sexually transmitted infections. However, sex most certainly predisposes to both. Okay, so in other words, it is a risk factor for both because it kind of disrupts the vaginal microbiome down there. So penetrative sex definitely causes, bacterial imbalances, either promoting Candida or promoting BV. Now, the reason BV specifically is not considered an STI is because, like in the case of thrush, a woman can develop BV before her sexual debut. And
I have to laugh. I love how you phrased that. It was so poetic, before her sexual debut. So
yeah, what can I say?
very,
but it's,
very poetic.
She's a virgin, okay? When she's a virgin, she can also have BV. So, it's not considered an STI, okay? But yes, sexual activity really can pose as a risk factor for the development of BV. Now, here is where, I feel like the glass is going to shatter. This is groundbreaking research. And doctors who are tuning in, because I know that you're there, listen up, because I learned a lot doing the research here. Now, new studies have shown that if you treat the partner, girls who have recurrent BV infections, defined by 3 or more per year, if you treat the male with dual therapy, metronidazole, clindamycin, then it actually reduces the recurrence in females. So almost implying it might actually have an STI vibe to it, because women relationships who are constantly getting BV, the studies show that if you treat the partner, then the likelihood of that the female partner developing recurrent infections is actually lower. So yeah, guys, doctors also beware. Yeah, I had this is very new research coming out. Obviously, longer term studies need to demonstrate the long term effects. Maybe recurrence happens at a later stage. There's still a lot to be determined, but the research is looking quite promising that men should similarly be treated.
And are there any other kind of, who is at risk? So we mentioned already that for thrush, it's generally girls of puberty age, particularly younger girls, kind of ends around perimenopause. What about bacterial vaginosis? I mean, it does show that maybe women with certain sexual partners or something like that, or sexually active, that seems to be a risk factor. Who else is a candidate for this? Candidate? More at risk.
More at risk. So I love also again that you mentioned hormones, because here's another very interesting point. We mentioned estrogen is a risk factor for thrush. So being on the pill, high doses long term, can predispose women to thrush. The converse is true for BV. Estrogen is actually protective against BV. We can go into the reasons why, but this actually implies that women who are postmenopausal, when the estrogen levels drop, they are at risk of BV infection. So it's actually more common in the older women. I mean, super common in also girls of reproductive age. I see it very commonly, but it's more common in the older populations. So,
I mean, we've mentioned so much. So just to kind of capture what we've spoken about so far. So thrush more kind of prominent in kind of adolescence, coming up puberty age, people with diabetes, high sugar diets, staying in their swimming clothes, clothing, etc. Bacterial vaginosis, on the other hand, could be linked potentially also from a sexually transmitted standpoint. And then there's also the estrogen factor. So actually, estrogen can help prevent bacterial vaginosis, whereas the surge in estrogen can kind of cause thrush. So women who have the lowering estrogen, they are more at risk of BV, if I captured that correctly.
Yeah, yes, that's very true. IUD, the intrauterine device, is a bit contentious. So some studies do suggest that IUDs that are lined with copper, so non-hormonal IUDs, can predispose women to BV specifically. The studies, they're moderate evidence studies, because it hasn't effectively been demonstrated that the removal of the copper IUD decreases the prevalence of recurrent BV. Having said that, hormonal IUDs like Mirena, Kyleena, for example, they show no increased incidence in BV. And yeah, I suppose, I mean, just on that note, if you want to reduce your risk of BV, condoms always advised. Not because BV is an STI, as we have hopefully communicated, but just because it has been shown to reduce the risk. And then, of course, treating the partner, always very important as well. And then really diet contentious, because there's a lot that, I don't know if you've heard, Em, but people put yogurt up their vaginas, and they do all sorts of weird things.
Well, isn't there
Have you seen
something
any
that
of
if you
that?
do have like I have, but isn't there also, I think that's also because of like thrush and the itching. So it helps because yogurt also like helps if you've got like a rash or something like that, it soothes it or something like that. So it could also be that. But I have heard that like if you are eating like kefir and all of that kind of stuff, those kind of foods within your diet, that is obviously really good. And things like kefir with a lot of probiotics and everything can help you because, as we were saying, also with regards to antibiotics offsetting your flora, then probiotics can hopefully help to balance that, right?
Yes. Okay. So just to clarify, please do not put yogurt in your vagina. That's never recommended. It's only going to worsen your thrush and possibly cause dysbiosis and cause you to have BV as well. So never recommended. But what you're saying with those foods that you mentioned, the kefir, the sauerkraut, like those are all high in probiotics, and they contain high fiber. And high fiber is correlated to a higher likelihood of the lactobacillus bacteria, the good bacteria, dominating and thriving in the vaginal microbiota, which is what we want if we want to prevent BV and thrush. So yes, high fiber diets, that has been shown to have some loose correlation. But generally speaking, it's not possible to change the sugar or levels in the vagina through diet alone because, as I mentioned earlier, the vaginal glycogen is produced by the vaginal cells that sit in the vagina and influence the estrogen locally within the vagina. So,
but I have read that if you do have a very high sugary diet, like if you're eating like a very poor diet, then thrush can be linked to that. So it does seem like it could be a causing factor if you're eating a horrendous sugar diet.
Sure, but I think but the mechanism that explains that is that if you're having a very high processed sugary diet, it predisposes you to diabetes, and we know that if you have insulin resistance and diabetes, it kind of causes glucose to spill in the vagina, and that can cause the proliferation of yeast and predispose to BV. But it's not from ingesting the food itself. So I just want people to get that concept out their head that if they're eating something in the mouth, it's going to cause dysbiosis in the vagina. In an indirect way, it does, but it does not do it directly. So for that reason, no specific diets are recommended according to the guidelines. So if it was so obvious, like there'd be guidelines that say like you can't have this, you can't have that, but that's not the case. Occasionally, patients do report episodic vaginitis, which is like flare up and itching of the vagina after having consumed large amounts of refined sugar products in excess. Under these circumstances, yes, I would agree it would be avoided. One should just maybe keep a food diary and recognize they're precipitating foods, but it's not stipulated in any guidelines in any way. Although I'd love to believe that like there are direct links. They're not.
And I'm sure there's also going to be a lot of people that say, because we know that it's hormonally linked, right? So estrogen linked.
Yes.
And there's a lot of people who say that you can have estrogen or hormone balancing diets, right? So that's kind of the inverse. But I know that you're not exactly the biggest advocate for that.
Yeah, I think hormone balance is such a catchphrase and marketing term. Like, what does it mean? Balance your hormones. Like, I don't buy into that term at all. Like, I don't know what that means. Yeah.
So okay, we spoke about diet is definitely not something that you can do to prevent this, or at least unlikely, unless you're eating high sugary diets and you stop doing that. But what treatments are there? What treatments are available?
Great. So in the case of thrush, we have wonderful antifungal creams and also oral pills that can be prescribed. Creams are typically first line, whereas oral fluconazole, the oral pills are antifungal pills. They are prescribed in cases of recurrent vaginal infections. But patients who are pregnant, which by the way would be another risk factor for thrush because your immune system is lowered when you're pregnant. So when you're pregnant, you cannot take oral fluconazole. So even if it's recurrent, you'll commonly just be prescribed clotrimazole cream, the antifungal creams. Whereas BV is treated with oral antibiotics. Okay, so metronidazole, clindamycin, two commonly prescribed ones in our setting. But yeah, it's oral antibiotics. There's also boric acid, which I've been reading up quite a large bit about, and this is both an antifungal and an antibacterial. It is, however, not first line. So according to the guidelines, like it's not even really mentioned yet. It's evolving. There's lots of evidence now slowly demonstrating that it has very good antibacterial and antifungal properties. But because it is toxic if ingested accidentally and cannot be used in pregnancy, it's not commonly prescribed as first line.
Perfect. So I think we've spoken a lot. We have spoken about, what is a yeast infection or thrush versus bacterial vaginosis. Why does this happen? Who's more at risk? And the role of diet in it, the role of hormones in these disorders, I want to say, and what treatments there are available. So if this is something that you are suffering from, it's absolutely no shame, and it's as very, very, very common, and definitely something to address with your doctor, who can prescribe the right treatment for you. And for those of you going off to go bake after this and try activate your yeast using sugar, I'm sure you're going to look at it very differently after this episode.
Yeah. No, thank you so much for entertaining me and enabling me the platform to speak on two topics that are super close to heart, vaginal yeast infections and BV. And to all my ladies who are listening, to all those patients who have all the long lists of questions, I hope that you've saved this episode. Do share it with a friend. We all have someone in mind who's going through this. And guys, if you like this episode, don't forget to hit subscribe and follow and share with all your friends and family and like the whole world. We want to go global. And it's just such a pleasure chatting with you all today, even on a Saturday night. So with that said, I'm going to head out now, and I hope you have a beautiful evening. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. We'll see you soon, follicle friends.